Welcome, everyone. Thank you for attending today. This is Joanne Morgan, Senior Health Specialist here at Art Jetter and Company, and I'll be hosting today's webinar. And we are so pleased that you have arrived today, and along with our presenter, Jeremy Grantham, Sales Director, Medicare Supplements from Mutual of Omaha, who is presenting. Before I introduce Jeremy, everyone's lines will be muted throughout the webinar. If you do have any questions, feel free to type them into the question bar, and we will answer those at the end of the call. I have also added the handouts, which you can download during the presentation. Now, here at Art Jetter and Company, we do have talented and skilled senior health specialists. So if you do have additional questions after today's presentation, please feel free to call us or email us. So once again, I'd like to turn it over to Jeremy Grantham. We do welcome you, Jeremy, and so appreciate you taking time today. So I'll hand it over to Jeremy.
Thanks, Joanne. Good morning, good afternoon, everybody. Again, my name is Jeremy Grantham, and I am a sales director here at Mutual of Omaha, and I have the pleasure of working with Art Jetter and Company and helping with our Medicare Supplement sales. So I'll be the presenter today about MACRA. We're going to be discussing all things MACRA, like what it is, how it affects your clients, what Mutual of Omaha has done to prepare for it, and finally go over a few examples of how the plans are now being offered in our e-app. So at the end of the presentation, we'll also cover some of our value add programs that we have with our Medicare supplements and some of our industry-leading agent programs. So with that, let's just go ahead and begin. So first off, what is MACRA? Well, as you know, MACRA stands for the Medicare Access and CHIP Reauthorization Act. It was signed into law in 2015, and a few things were included in the act. One item you guys are already very familiar with, it was a requirement to no longer use the Social Security number for the Medicare number. The other key component of the law is to try and contain Medicare costs by limiting first dollar coverage on Medicare supplement plans. The rule states that as of January 1st, 2020, just this last month, any newly eligible Medicare beneficiaries will not be able to purchase Medicare supplement plans that cover that Part B deductible. That includes Medicare Supplement Plan C, F, High Deductible F, and in Minnesota and Wisconsin, the riders that cover the Part B coverage. So, how does this affect your clients? Well, that all depends on their Medicare eligibility date. For your clients who are already Medicare eligible or will be or were through December 31st, 2019, their Medicare options are the same as they've always been. They can keep their existing plans or purchase any plan that covers that Part B deductible. The MACRA rule will only impact your clients that become Medicare eligible after December 31st of 2019. Those customers are what you hear the words considered newly eligible, and those will not be able to purchase the plans that cover that Part B deductible. Their plan choices must include some type of cost sharing. We'll kind of go over some of those scenarios a little bit later in the presentation to show how that actually applies. Okay, well, as with any change in the industry, current and future customers, they're going to be looking to you, the agent, for advice. So this is, really important that we take the time to fully understand the MACRA rules and explain this to them and how they work. We here at Mutual of Omaha, we knew that current customers would have some concerns about what they may hear. So last year, I can't believe it's been almost a year, in March of 2019, we began sending out communications to all of our Medicare supplement policyholders, explaining to them that they may keep their current plan if they already have one. They have also been seeing reassuring messages from us online to help them understand what this rule may or may not mean to them. As you can probably not be surprised, there are some agents out there that MACRA is a good scare tactic to use, that you got to change your plan, you got to do this, and it is causing some confusion in the marketplace, but Those statements are not true, and so we as a company, provider of the Medicare supplement, we really wanted to get ahead of that and really help kind of ease our customers' minds with what is available to them, what type of plans do they have now, can they apply for the future, or if they're newly eligible, what are the options for them. So now, let's talk about some of the changes that you have or will be seeing as a result of the new MACRA rule. The first change that you may have already seen is the change to our application. So if you've already been writing us, since you've probably seen it since last July, we added the Medicare Part A eligibility date field to our Get a Quote page. This change did go into effect July 1st of 2019 because that was the date that we could start taking applications for a January 1st start date or effective date. So we really needed to be prepared back in July in order to take those open enrollment policies that we're applying in advance. And very important change is this date is what drives what plan your customers can purchase. If you are not currently using our e-app for your applications and you're using a paper app, I would highly recommend giving it a try. Otherwise, it's up to you, the agent, to kind of determine what plans your customer can purchase based on their eligibility date. If you're using the e-application, once you put that eligibility date in there, it's going to filter out any of the plans that aren't available if they're newly eligible, but will show the plans if not. So again, a little bit later in a couple more slides, we'll go over some of the scenarios and kind of walk you through so you can visually see how that's actually working. Okay. Okay, just getting caught up with the slides there. Apologize about that. Okay, well also, MACRA did include a new high deductible Plan G. This plan is available for policy effective dates of January 1st, 2020 and after. High deductible G, it includes an annual policy deductible of $2,340. That's 2020 numbers, and a Part B deductible of $198. Again, this plan works very similar to if you were familiar with the old high deductible F plan. The biggest difference there is obviously it can include that Part B coverage, or Part B deductible amount. So paying the Part B deductible out of pocket does also help meet the annual policy deductible. So that Part B deductible of $198 does apply to the overall deductible for the policy. As with all deductibles, we have to mention that the amounts are subject to change. So, please keep up to date as what the current annual deductibles are for that, as again, those do change throughout, year to year. Now, since Medicare eligibility date is now what determines what plan your clients may purchase, let's take a look at the available plans that we have here at Mutual of Omaha and our affiliate companies. Again, going back to those eligibility dates, if your eligibility date is December 31st, 2019 or before, the available plans available are A, C, D, F, G, N, and then also any of the old high deductible F states or the new current high deductible G states. So additionally, with this, MACRA does make plans D and G the guaranteed issue plans for newly eligible Medicare beneficiaries. So currently, those replace the F and C that were previously the guaranteed issue plans for those members. So again, one thing that we like to point out and note here is during those times, a lot of people think that D&G is going to be the guaranteed issue plan for everybody. One thing that we really want to focus on is D&G will be the guaranteed issue plans only for newly eligible. So if somebody who was previously eligible has that guaranteed issue right, they will have to go back to the F&C as their guaranteed issue plan. So just one thing to keep in mind, we've been seeing quite a bit of confusion on that, and so we really wanted to point that out. So again, policy offerings vary by state. For state-specific details, you can refer to our Medicare Supplement underwriting guide. That's available out on Sales Professional Access. And we also have our map that shows the availability of what plans are available in what state. So now let's kind of take a look at how that all applies into a couple scenarios to better see how this applies out to your customers. So first, let's talk about the two scenarios we're going to go with. We have two customers that are looking to purchase a Medicare Supplement policy, both with an effective date. We'll just use January of 2020, or January for 2020 for the first applicant and March 1st of 2018 is their eligibility date for the second applicant. So again, they're both looking for a new policy that's going to be effective in 2020. Applicant A is eligible in 2020. Applicant B was eligible for Medicare back in 2018. So 65, 67, you're going to see they're both applying for a new Medicare supplement policy, but they're going to have different scenarios based on that eligibility date. So, as you can see on this slide, with the new change as of July 1st, you now need to enter the applicant's Medicare Part A eligibility date in the required field. His date is going to be 1/1/2020. Once you select Get a Quote, you will see the plan offerings that applicant A is eligible for. Since he is considered newly eligible after January 1st, 2020, he can purchase plans A, G, or a plan N. If he was purchasing this in a state that has the high deductible G plan available, he would have seen it on this screen as well. Now, let's look at applicant B's options. Even though she is also applying for a policy effective date of January 1, 2020, her Medicare eligibility date was 3/1 of 2018. That makes her previously eligible and will allow her to have more plans to choose from. Since she was eligible for Medicare in 2018, she has now the option you see here to purchase plans A, F, high deductible F, G, N, and since she resides in one of the states that has approved the high deductible G policy, she also has the option to purchase that plan. I think kind of with all this information you've seen on the screens, kind of what we've talked about, you can see that the Medicare eligibility date has become such an important part of the Medicare supplement process. And that's really why we kind of focus on that. And really think it's beneficial for you guys if you're going to be out there, if you're going to be using it. The e-application has many benefits to use over paper applications, but you can see one that it's going to limit those plans available based on their eligibility date, and that's key with the new MACRA legislation. So again, if you're taking paper applications, you really need to pay attention to that eligibility date to really decide, can I offer the plan F? Can I offer the high deductible F? Or in some of the scenarios, has the state approved the high deductible G plan or not? We have maps available that you can look at to see the policy offerings in each state, but again, those are going to limit down now based on the effective date. So stuff to keep in mind. One other point, just kind of talk about the MACRA issues that I think you guys may be seeing out there is we do have about a handful of states, I believe it's less than 10, that have not approved our current outlines for MACRA. So you hear all the talk about MACRA, about how we're supposed to be limiting these plans, and then you go look at one of our outlines and you see this outline's an old outline. It doesn't show the MACRA stuff out there, but I need to follow those because MACRA is law and it is here now. So we're working with the states. As soon as they approve those new outlines, you're going to start seeing all those adjustments made. But again, we're waiting on the states for that. I believe, like I said, about 40 of the states have already approved the outline. They're ready to go. If you're looking at the outline, it shows you what plans, how they apply, the MACRA rules, all that great stuff that you get from those. But there are a few that you will see that it just doesn't seem to have MACRA incorporated. And again, those are all because we're just waiting on the states to approve the outlines. Again, that doesn't mean that the law doesn't apply. The law still applies. The outline itself just has to be the one that's currently approved with the state. So a little bit of cleanup that still needs to be done as far as those go. I would fully think that they'd probably be done cleaning those up over the next few months. So again, some states are slower than others, but hopefully we'll see those change and everything get there here real soon so it's all cleaned up. So with that, that's kind of the high level on MACRA. I know there's so much more to it than that. You probably have multiple questions. We will address those here a little bit later towards the end of the webinar here. And again, like Joanne had mentioned, if you have any questions after this or you really want to know some more scenarios or more information, absolutely reach out to them. They can answer your questions. If they want our perspective on it, they'll absolutely reach back out to us and we'll be happy to help. So we'll kind of move forward and just take a couple quick minutes here. We're not going to focus too much on it, but we're going to talk about Mutual of Omaha value adds with our Medicare supplement and also some of our agent programs that you may already be taking part of or you need to know a little bit more about. So our Medicare Supplement policyholders have, always told us that they want extras that help them stay fit, healthy, and keep more money in their pockets. So when they purchase a MedSup from Mutual of Omaha or one of our affiliate companies, they get access to the programs you see here on the screen. It's our Mutually Well Wellness program that has an optional gym membership program that can be purchased for only $25 a month. It's great. It's got thousands of gyms in the network that they can choose from. There's no fees associated with it for the monthly or annual fees. There's no sign-up fees. It's just $25 a month. They can turn it on and off as they wish to. They also receive discounts on hearing aids, eye exams, and more through our Amplifon and iMed Valueadds. So it's definitely something that is out there that your customers are asking for and that we're very happy to provide with our Medicare Supplement policies. Again, these programs are not insurance. They simply make money-saving discounts and services available to our policyholders through a third-party provider. And that's exactly what your clients are looking for when it comes to this type of savings. So now, let's discuss some of our industry-leading agent programs. First, let's talk about our improved marketing credits program for 2020. What's new about it is for this year is that we have combined our Medicare Supplement and our dental credits into one program. All it takes is a number of issued Medicare Supplement or dental applications in a month, and you'll receive marketing credits that can be used for leads you may purchase, postage for your mailings, advertising fees you may have, or even equipment that enables you to use our electronic tools for doing business with us. You can see here the minimum applications for each month to qualify to start earning credits are 5 Medicare Supplement applications or 2 dental applications. Once you reach the minimum number of eligible issued apps each month, we will start adding marketing credits to your account. While the MedSup and dental apps cannot be combined to hit that threshold to qualify, the marketing credits you do earn in each product category will be combined to give you one account balance. So in the past, we were managing like a MedSup marketing credits program versus a dental marketing credits program, and you had to, submit different receipts, different submissions, all combined now. So again, the MedSup apps have to be made at 5, the dental at 2. You can't combine those to reach those thresholds, but at the end of it, all the credits will be combined into one account, and you can check your balance anytime on Sales Professional Access. So very excited that we get to keep this going for another year. You can earn lots of credits out there that really help you build your business. Like I said, we all know how expensive postage can be or leads. So why not write your business with us, get a little extra credits, and let us help take care of some of those expenses through this credit program. Okay, and again, we are pleased to announce again that the Medicare Supplement Broker Bonus has been approved again for Q1 2020. What this means for you is you have the ability to earn that additional cash bonus when you sell our Medicare Supplement products in the states that are listed in the next couple of slides here. So with this, again, you need a minimum of 5 Medicare Supplement policies issued in a month to meet the criteria to receive the bonus. If you hit that threshold, the bonus pays $150 per issued underwritten app and $30 per issued open enrollment app. Again, only certain plans and states are eligible for payment, so please take a look at that Q1 2020 broker bonus flyer for more details. That one, I believe, is available in the handout section that Joanne had mentioned as well. All the details of this program are out there and ready for that. So how much can be earned with our broker bonus program? Let's take a look at the scenario on the screen here. If you issue 10 Medicare Supplement policies a month, half of those policies are underwritten, and half of them are open enrollment. You can see here through the math that you could make an additional $900 per month in bonus money. That's over $10,800 a year if you hit that threshold of 10 apps every month. So definitely exciting that we're going to offer this again. I think you can earn a lot of money out there. Again, if you need to write the Medicare Supplement anyway, take a look at us, get this extra bonus. You can see it can be added on to those marketing credits. Those marketing credits can help pay out for expenses. So really pays to write with us. And I think we're very proud with some of these agent programs that we have available for you guys. Now, again, I had mentioned earlier that the states that are eligible for the payment, those are what you see here on your screen. I kind of won't read them all to you. Again, they are available in that broker bonus brochure. Just remember that Any app written in any state, even not on this list, does go to those 5 qualifying apps for you to qualify for the bonus, but only the states listed here on the screen or on the brochure are the apps that are eligible for payment. So again, all states count to the 5 to get to the threshold. We'll only pay if they're in this list of states though. And last year we were able to get an additional program for those of you writing in Montana, Indiana, Missouri, South Carolina, and Wisconsin. So we're happy to say that this bonus program has been extended as well for at least Q1 of 2020. And the way this one works is basically the qualifications for this program is the same as all the other states. The biggest difference is the payout amount. So for these 5 states, the bonus is $40 cash per app once you have qualified. So again, that broker bonus flyer, this is on the back side of that. All the information's out there if you're writing in those 5 states. And finally, don't forget about our industry-leading mutual sales leaders agent recognition trip. This is a very exciting trip. I've been on it myself. Talked to agents who go on this on an annual basis, and they stay at the top of the industry. It's a really good time. And for 2020 qualification, we are pleased to announce that we will be heading to the Magic Isle of Maui, Hawaii. That trip will be in March of 2021 based off of the 2020 qualification. So very excited about that. To qualify, you need 275,000 production credits. You can earn those credits based on your net issued business. You receive 1 credit per dollar of ANBP for new Medicare supplement and dental policies, and a half credit for internal or affiliate conversion or replacements. Again, the qualification period has already started, so anything you've already written for the year with us is part of that. Your credits are adding up. It runs from January 1st through December 31st of 2020. So again, those are just a couple of our top-notch agent programs that we have available for you. Any questions on those can be asked as well, but we have a lot of flyers and a lot of information out there available. It's all available on your Sales Professional Access login when you get with us, or like I said, reach out to Art Jetter and Company, and they'll be happy to assist as well. So with that, I'd like to thank you for joining us today, and I know we had talked about possibly getting some questions and answers, so if there's anything related MACRA that you'd like to talk about.
Jeremy, I do have a few questions that have come in, if I could take the liberty of asking you. So first of all, I have one agent asking how easy is it to add the dental or vision application at the time of sale of the Medicare supplement. Do you see that happening a lot, or is it just a here and there situation? Are dental and vision sales up, or?
Yeah, that's a great question, and it absolutely is. It's kind of two-part: is how's it happening and what's it going. To start with, the easy part of it is it's very easy, especially if you're using that e-application. It's just another click of the box. It adds the application to it. You answer a couple more questions. I believe it takes probably less than 2 minutes to add the dental on if you've already filled out all the information for Medicare Supplement. So very easy just to add that dental on. At the end of the day, you apply once with our e-app, and we take care of the rest by getting the 2 policies issued on our end. So it couldn't be easier. We are a little bit newer to the dental plans. We have not been in them that long, but we are seeing very good strides with it. We're seeing quite a bit of policies. I would say early on, a lot of it was we were having problem with people adding them onto the Medicare supplement sale, partly because a lot of people didn't know we were in the dental world and kind of information about that. But some of the latest numbers I saw for last year is we're getting to be about half of our dental policies are added to a MedSup sale with some of our larger groups. Yeah, right. So it's really the traction's picking up. People are seeing it. It is a need out there. If you look for seniors, do need the dental care, so a lot of them just don't know they need it or don't think about it when they're signing up for Medicare Supplement. So just a great point, just bring it up, because a lot of times they just don't know. And once you offer it, they realize, I do need some dental care. So it can be added very easily.
So, and then also there was a question on the marketing credits program. So is it easy for an agent to find out his totals on the agent portal? Because I've looked even myself in the past, and how does an agent find out his number of marketing credits? Because it would be up to him to basically look occasionally at those totals. Is that correct?
Yeah, correct. And it is very easy. I don't have the exact walkthrough of it right now, but when you log into SPA, up across the top, there's like products, and it talks about the Senior Health Solutions, Medicare Supplement Solutions. There's a section under that title that's like sales tools and all that. And once you click on that and kind of scroll down, it talks about our programs. And then there's a link that says check your balance here and things in that. So, yeah,
Perfect.
very simple. Up there where everything else is located as far as our product information. We have some, a couple of other training webinars out there that are just, little micro webinars if you want to know something about us. So it's all available out there. But yeah, you can check your marketing credit balance there, and it also tells you of how to submit for reimbursement for those.
Okay, and then I do have a question on MACRA, and the question posed is if a client who is Medicare eligible before January 1, 2020 is under a Plan F currently and want to change to Plan G due to premium, can they switch back to Plan F at a later time if they want to?
Yes. The short answer to that is yes. So if they want to switch to a Plan G, they would have to go through underwriting. But then again, they could switch back to an F at a later date from that G if they could pass underwriting again. So
okay, perfect.
Yeah, the F plan does not go away completely. Now, one thing to watch is we can't speak for every carrier, but there will be, we think there will be some people that will be getting out of just won't offer the F product or F plan. That does not mean that it's going away 100%. We have no plans right now to get rid of it. So as long as we still offer the F plan, that customer in that scenario would be able to go back to an F if they wanted to. However, it would be underwritten.
Okay, thank you. And just to let the attendees know, this webinar today is being recorded and will be available to you very soon. We can send it out to the attendees, or we will be sharing that, I believe, on our weekly training calendar. So we're very pleased about that. And if there are no further questions, I am going to, first of all, thank Jeremy for his great presentation today. We certainly appreciate that and our relationship with Mutual of Omaha. And then once again, if you do have any questions or need our help with anything, we have a very talented resource group of people here that can help make your 2020 extremely successful. So with that, I thank you once again, and we'll talk soon. Thank you.
Absolutely. Thank you.
Bye.